This is one of those wins you can put in the win bucket. You can give a child their voice. There are several different types of augmentative and assistive communication devices. They range from high-tech to low-tech. Low-tech can be something as simple as a picture. I use that most often in the ICU setting, where patients are intubated or they're not able to use their voice to speak. So they can point to something on a card and say, I need to go to the bathroom or I need to take a nap. There are mid-tech devices that utilize electronics. This can be something as simple as a button or a switch that you push to activate a desired action. So push this button if you want to be done with this therapy session, and they activate the button. A mid-tech device that can be used also would include an electronic tablet that would have an app on it where you could download specific pictures and you push a button on the app and that activates either speech generation, or you can have a series of pictures to choose from that's much more quick than paging through paper pictures. A high-tech device is oftentimes what we think about when we think of augmentative communication. It's where you have a speech-generating device that's very complex. If you think back to Stephen Hawking, his was a very high-tech device that he used to communicate. When we think about screenings, the developmental screenings that we do to make sure that our children are developing appropriately, communication is one of those that we assess right up there. And if kids are not meeting milestones as far as communication goes, it is incumbent upon the pediatrician to take additional steps. Those steps include an early referral to speech and language pathology so that if we need to use a communication device, we can. But one of the big misconceptions that families and even some physicians may have is that a speech device, even a low-tech one, may impede development. That's not true. It helps development, and it actually gives children different neural pathways to access communication. And those pathways that they lay down using augmentative or alternative communication, they can still be utilized for traditional vocal communication. It's just kind of a different circuitry. If a child can't communicate, that is going to have reciprocal effects on other aspects of development. So if a child is hurting and they can't communicate that, they are going to act out and have challenging behaviors. And then that might impede their emotional or social development. That also may have reciprocal effects on their physical development, their self-care skills. So early identification of a speech delay and early support is absolutely essential for development. One of the reasons I was asked to collaborate on this report is that my son uses augmentative communication and used it when he was young. When he was very young, he was not able to speak. I didn't hear him say mom until he was about 5 years old. My husband, who is also a pediatrician, was very concerned that if we used augmentative communication, that would stunt his ability to develop. Fortunately, I was armed with a literature, and I with the help of our pediatrician and our speech and language pathologist, got my son to be a very fluent user of alternative and augmentative communication. He now will not shut up. He is a teenager. He does not have to rely on alternative communication means at this point. So I feel very passionate about communication. It is truly the key to unlocking a child's potential. Mobility, self-care, all those are important, but if you don't have communication, if you don't have a way in and out of a consciousness, it's very challenging to have intact development. One of the reasons that it is so important to be very assertive at identifying these delays and accessing care is every day that you don't have that device, you are burning developmental time. And I grew up with my dad saying, you're burning daylight, this is your burning developmental time. And the sooner that you can get a child effectively using an augmentative or assistive communication device, the sooner they have their voice, the sooner they can reciprocally engage in communication and interaction with those around them. So there are several barriers to accessing assistive and augmentative communication technology. One is simply finding people that are familiar with it. And so finding a pediatrician that is familiar with it, finding a speech language pathologist that is familiar with this technology or the need for it can be challenging, especially in low population states or in states where there's a high rural population. So once you have somebody that knows the device that you need, then you have to figure out how that's going to be paid for. And that's another hurdle that a lot of families and pediatricians will run into. The best way that I've found to overcome barriers to acquiring assistive and augmentative communication devices is to make sure that visits are documenting the need for these devices. So making sure to say, this child is not able to speak and that is impeding their development in these ways. This child demonstrates the capacity to be able to communicate because we have this speech therapy report that shows that they're able to engage in receptive communication, but they're not able to engage in expressive communication. We know that if a child does not speak English as their primary language, we know that if somebody that is African American, we know that healthcare access is less, just in general. We know that somebody with a disability, they are going to have less access to care in general. Then if you look at geographical barriers, in the state that is very spread out, very rural, it can be difficult to make appointments with these various specialists. A lot of the specialists that you need may be concentrated in urban areas. Transportation is a barrier. Traditionally used telemedicine techniques are difficult to access because internet access may be spotty. So even if you have access via telemed, you may not be able to use that access without reliable Wi-Fi. But the good news is because pediatricians are so familiar with those different barriers, we know how to recognize them and we know how to support our patients. I think as physicians, there is an undercurrent of ableism throughout our training. We're taught what is normal, and then we're looking at deviations from normal. And rarely are deviations from normal presented in a positive light. They're presented as things that we need to correct. Assistive technology is not about correcting. It's about supporting. And it's about allowing us to engage with each other, looking at humanity as a spectrum of wonderfully diverse, beautiful beings that need to interface because we are social beings. And we do need to have all of these different perspectives. And the fact that we have somebody that is able to access communication from a totally different neural pathway than spoken speech, that's a beautiful thing. That's a beautiful thing.